So you quit your 9 to 5 to start your own business and try to reach that American dream. And the very next day you started shopping for health insurance and you say to yourself, holy F word that rhymes with fuck. These deductibles are so goddamn high. How do people accept this? These deductibles are so much higher than my group plan from my previous employer. Man, oh man, what am I gonna do? Let me explain. But before I do, if you don't know who I am, I'm Health Insurance Mark. I am him.
So who really cares?
I'm an active health insurance broker licensed in 20 different US states. Been shopping health insurance plans to thousands of individuals, families, and businesses for over a decade now. And my career to date annualized volume is over $9.6 million in health insurance premium alone on solo production.
Cares? Who cares?
I make these videos so I can help as many people as I can navigate through this cluster fudge of misinformation that we call the American healthcare system. Let's dive right in. So first of all, you got to ask yourself, what is a deductible? This video right here is like a mini series of health insurance basics. So this is just the first part. I'm going to make like 4 or 5 other videos that talk about other basic things like co-insurances, co-pays, in-network, out-of-networks. But this video is about deductibles. What is a deductible? If you remember from a previous video, your financial exposure, if God forbid like a car accident, cancer, stroke, pickleball, sports injury, and let's say it's like $50,000 worth of medical claims. The financial exposure formula is deductible plus coinsurance equals total out-of-pocket max. Deductible is your first line of financial exposure.
Why do I need to know this?
I'm making this video because people are scared to shop for health insurance plans. They think that the deductibles are so darn high, and it is so darn high. But I want you to understand that you don't have to reach the deductible for a simple doctor visit. For example, this quote right here of $10.62 a month, this is for a household of 3 and with an income of that. And we're not going to get a subsidy based on where we live in. So that sucks. But the deductible is $9,000 per person now. It is not for the entire family of 3. It is per person. There's no charge for preventative care visits. So for like an annual checkup, blood work, cholesterol screening, that stuff is all no charge. And you want to ask yourself, what is no charge? Remember, go to healthcare.gov, type in preventative, click on search, and for adults, women, children, kids vaccines, children immunization, all of these things are free. You don't have to be your $9,000 deductible. These are all free so long as the results are normal. I explained about that in the previous video about preventative wellness visits. For adults, click on for adults from numbers 1 all the way down to 22. All of this stuff is free. You don't have to meet your deductible. All of this stuff, again, is free so long as your results are normal/healthy. So hopefully they are normal/healthy. However, if you got a boo-boo and you got a flu or you're sick or whatever small minor injury and you want to go see a primary care physician, you pay full price. A doctor visit is going to be about $200 to $300 nationwide average. If you want to go see a specialist like dermatologist, cardiologist, cardiologist, did I just say that? Any doctor that ends in an IST who went to medical school longer, they're going to charge your ass a little bit more than just $200 to $300. It could be $300 to $500 for a visit, depending on where you go. Yeah, let's do an example of that. So, remember, preventative care visits, before school starts for the kids, immunizations for kids, that stuff is going to be no charge. But if you got a flu or a cold, and NyQuil, DayQuil just isn't cutting it, and you want to go see a primary care physician, again, normally they charge you anywhere from $200 to $300. Actually, let's go $250. $150 to $250. And so long as you have health insurance, this particular quote is from Blue Cross Blue Shield. And as long as you're in the network, you get anywhere from 20 to 30%. So let's just say it's 25% off $200. So 25% of $200 is going to be $50. So 200 minus $50 equates to $150. Because I have a $9,000 deductible, and by the way, it's per person, not just for the entire family, my $9,000 deductible is reduced by $150 balance from that doctor visit. So therefore, I have a balance of $8,850. Okay? And let's say I got that done sometime in the month of July. By the end of December 31st, this $8,850 balance that I had, and let's say I didn't see the doctor at all for the remainder of the year, my $8,850 deductible balance is gonna jump up back to $9,000 when December 1st, 2025 hits or comes. So every January 1st of every calendar year, your deductible resets. So if you're going to get something done, try to get it done at the beginning of the year, not towards like the end of the year, because it already resets starting January 1st, 2025. That's one advice for you. And now it says per person. And when you look at the summary of benefits, this is the be-all, end-all. Per person is a $9,000 deductible. But let's say in this scenario that my family of 3, we're doing a mini road trip to the Dells, and we got a bad car accident, and it's like $100,000 worth of damages. So the deductible is $9,000 per person. That is the deductible. The summary of benefits says that for a family, as long as you're in the network, it's going to be $18,000. Holy cow. So, in this scenario of $100,000, that deductible is a times 2. So this is really $18,000 deductible. That sucks. But if we're all unconscious and the ambulance sends us to a hospital that is not in the network or non-participating, we will be subject to a $45,000 deductible. So out of a $100,000 bill, minus $45,000, we're still in the hole for the other $55,000. And even if we're paying $1,062 a month, if we're out of network, we could be subject to still $55,000. That is how much you have to make sure that your network is a PPO versus an HMO, because PPOs have access to more doctors and hospitals. So, yeah, per person, it could be $18,000 for the family if you're in the network. If you're in the network. Oh, and by the way, if an accident happens, like a car accident, it's $100,000, and we're exposed to $18,000. Some people might get scared and consider a lower deductible instead of a $9,000 deductible. They might consider a $750 deductible, but that's an extra like $700 more per month. You're not going to hit this $9,000 deductible based off of doctor visits or specialist visits. You're going to hit this $9,000 deductible if shit happens to you, like an accident or a major illness diagnosis. Okay? You would want to consider a supplement, kind of like Aflac, that quacking duck on TV.
Aflac!
So, for an additional $148 more per month, I can wipe out my high-ass $9,000 deductible in the event of an accident or major illness. So 1,062, so 1,062 plus the quote of 149-ish is going to be $1,211. I would rather pay $1,211 to wipe out my $9,000 deductible than having to pay $1,766 a month for a small $750 deductible per person. Because, yeah, 1766 minus 1211, that's a savings of $555 per month. Times 12, I could save close to $7,000 if I just add a supplement. So, if you're fairly healthy, you don't have any pre-existing conditions like diabetes, you don't see the doctor every 3 months, I would choose a high deductible because it is the most affordable. Even though this doesn't seem affordable, it is the most affordable because it's got the highest deductible. So understand that relationship. The higher the deductible, the lower the premium. The lower the deductible, the higher the premium. But if you're a healthy family and you just need health insurance for just in case reasons, consider a high deductible and cover your ass with a supplement that is at least that $9,000 exposure. So this is a $10,000 per person per calendar year. Hope that helps. Let me know if it doesn't. So I want you to understand that just because your deductible is $9,000, you don't have to meet it to go for a doctor visit. And if crap happens to your family, it's not just a $9,000 deductible for the entire family. It is per person, so long as you're in the network. And remember that this deductibles reset every calendar year. Calendar year. Yeah. If you got questions on this, just send me a DM or send me an email. But watch this video right here because we're going to talk about copays and what that is all about.